What's up, guys? Welcome back to the Accelerate Your Life podcast. I am your host, Mallory, and I'm super excited for this episode because it's going to be very in the weeds, I think, very scientific, really fun. And I think it's something that a lot of people are going to be interested in learning more about. So, hello, Sierra. Hello to my guest, Sierra, who's going to be joining us and being the brains of this episode. Sierra is a functional practitioner and has been the one guiding me on my hormone roller coaster, the saga for the last year. And I will not go into much more detail than that because you guys have already seen the deep dive of my journey. If you haven't listened to the episode on that, go back and do that. It's quite a doozy. It's episode 25. But our guest, Sierra, she's incredibly smart. I've learned so much from her. And yeah, I guess we'll just dive right into it. I think that this episode is going to be great because holistic, functional doctors, these have all become like big buzzwords. And I think a lot of people, even just like air quotes, like lifestyle health people are starting to get on that trend and see that, which is good. But I think there's still a lot of confusion about like, what does that really mean? Do they need it? Do they not? So that's kind of what we're going to get into today. But before we get into that, I want to ask you a question I ask every single guest just for fun when we start the episode. It's unrelated to anything we're going to talk about. Just a nice little wholesome question. So, Sierra, what is one thing that you love about life right now?
Oh, well, first of all, thanks for having me on here. And I didn't anticipate that question, so I'm very excited. Um, I am obsessed with being outdoors in the sunshine. And so I'm loving that I have a big backyard to do that in. It's the littlest thing that makes my day literally every day. So
I know that about you just from like obviously following you on social media because you're always in the grass. You love to play in the
always,
grass.
always, yeah, I'm obsessed with the grass and the sun. So I'm a pretty basic girl. I'm basically a plant. We all are.
I love it. Also, I just realized I need to be so much better about like letting my guests say hello before I just freaking deep dive into the episode. So before we do get into it, and we're going to talk all about like your background and everything, but is there anything that you just want to say or before we get started?
No, I mean, I can just dive into who I am, what I do, and really get into probably what people are interested in and the
Yeah.
nitty-gritty. Yeah.
Amazing. I think this is kind of going to be, I want this episode to be a little bit like the like functional medicine, like starter pack or like functional medicine for
Yeah.
dummies. We're going to kind of dive into that. So I think a good starting place will be, how did you get into functional medicine?
I love this question because I say anybody that's in functional medicine has a story. It's either them or their loved ones that had to figure out that this thing even existed. And I really appreciate that you have the awareness. And first of all, Molly, you're incredibly intelligent as well. And you have the awareness that a lot of the holistic space has become a buzzy place. And it's really cool to have discernment as to like what's going to serve somebody. And it's really awesome that your audience gets to have a platform, at least like learn to educate themselves as to like what's going to serve them or not, because there's a lot of stuff that just isn't wonderful out there. A lot of it is, but a lot of it isn't. And so for me, I'm currently double board certified as a functional medicine doctor, and PT technically. And so I started down the functional medicine path after 2021 when I was diagnosed with both multiple sclerosis, which is a progressive brain disease, and Hashimoto's hypothyroidism. And I was like doing all the things. I was eating clean, and I was actually bodybuilding at the time, taking all the supplements, and my body was just like falling apart. And I found myself in the hospital a lot of the time for about 6 months, and it didn't make sense to me. And so I finally went, and after being told I did have MS, I didn't have MS, I was told I was gonna be on black box medication, which gives you suicidal ideation for the rest of my life. And I was like, I'm too happy for that. Like, no, thank you. If that's your only solution, I'm out. So I got connected with a functional medicine doctor, another practitioner, and just like wasn't a good fit for me. So I kind of took matters in my own hands after I got my doctorate and I went back for functional medicine. And my intention is to take my Western medicine training and really marry it with the holistic path where we can use good data points to guide our treatment that isn't just, this medication or this supplement for this symptom. And that's why I'm here and what I do today.
Really just your own, you went through, your own story of needing to figure it out for yourself. And I think unfortunately that is what happens with a lot of people. And we're, I'm sure, going to get into kind of maybe some of our own thoughts around kind of conventional medicine. And I know on my end, like I definitely I'm not against conventional medicine, fully there. I think that all have their purposes. But I'm sure like opinions are going to kind of show through within this episode. And unfortunately, yeah, I think a lot of people just run into challenges, issues. They're told things that like, you hear the stories about like, you're never going to do X, Y, and Z again, and then they do. And it's like, there's obviously something missing, some gap missing, and not everybody though can go out and like figure it out themselves or choose to turn it into a career like
Yeah.
you did, right? So thank God, we have some that do, and then they can turn towards you. But you kind of touched on this. Maybe if you can list this out a little bit again. But I always like to ask, like, what gives you the right? Like, what is kind of in that meaning? Like, what are your certs? What is your schooling? What's your background?
Yeah. So I've been in medicine for over 7 years. My doctorate is in physical therapy initially, but it's a doctorate for a reason. There's a ton of training we have to know about all systems, including pharmacology, which I think is incredibly important. Something that's missed in the holistic space all the time is there's a lot of holistic education. We don't get into drug interactions and supplementation. And so that's, I think, a huge advantage into my training. Then I did go through the FDMP program for functional medicine, and then I've done countless certifications on top of it for different tests that I run with my clients that you've also been exposed to.
Yeah.
I was also trained and certified as a strength and conditioning specialist, and worked in athletic training for a few years. So like rehab, fitness, wellness was always my thing. And then I got into it and I worked at a hospital for a while and I was like, oh, I don't love this. and had my own diagnoses. I did reverse both of them. I don't think I shared that. All my symptoms. I used to be like bedridden, getting confused wherever I was going.
Wow.
Just like peeing blood. Like it was nuts.
At like
Absolutely.
what, 24 years old? 20.
Yeah, around there. Yeah, 22, 24.
Crazy.
And didn't make any sense for a really healthy individual. I have none of my neurological symptoms now. I don't have thyroid issues or antibodies. So it is possible. But yeah, I think that honestly, my education is strong. And also, I believe having the experiences that I've had and having to reverse those two and put both in remission is really what carries weight to me also.
Yeah, I think something that really like attracted me to you as becoming my practitioner and like makes me look up to you and trust you is that you are so well-rounded. Because I think a lot of people in different like parts of the space is that they're, the functional doctor, but they don't really understand the training aspect, the workout aspect, the people who have body comp goals along with the health goals that they want to focus on. Or you have the other, right? The personal trainer, but doesn't understand like the nutrition side. And you, I feel like really encompass kind of all the different pieces. There was one thing you said in there. I just want to make sure I understood. So were you saying when it came to the pharmacology, and like your experience more from like the conventional side, like that is kind of a positive you draw from the conventional side that you feel like the functional side kind of lacks is like how to utilize medications and that sort of thing? Is that what?
Yeah, or at least understand what medications are doing
Yeah.
to a body because typically, I forget the stat on this, but like at least 60% of Americans, if not more, on like one prescription,
Mhm.
and you can maybe pull them up, it's insane.
I would
Or
honestly guess
maybe
more
like
than
I
60%
think
these.
it's 80% or
Yeah.
something like that, and like 60% are on three or more. So the thing is, you're more than likely gonna have a client that is going to be on medication. And if you're not, understanding what that medication is doing, then putting a supplement into the mix is we need
Right.
to know what that supplement's going to
Right.
do. If you try to change that, and I think some people, just like when they're looking for functional practitioners, you really need to make sure somebody else understands their scope as to, you can't just come off birth control. That's a really hot topic. You can't just quit it cold turkey. I don't care what somebody tells you,
Right. Yeah.
it's not smart. So I think that was a huge strength for me is that it's allowed me to be a little bit more specific in supplementation. Not that somebody can't go learn that for sure. They definitely can. It just was something I was appreciative of in my education from conventional medicine. And I, by all
Yeah.
means, think that, not all drugs are bad. Like there's a
Right.
ton, right?
Right.
So.
And I mean, I think, and again, we'll get into this, but like the purpose of, I think, where conventional medicine really does shine is obviously being retroactive and fixing a lot of like, or helping support a lot of already existing diseases, which you often need actual like prescription medications for. So that's where I think, again, like the divide, there's such just a hot divide between the two. And we have our opinions of maybe which way we lean, but I really think they do have to fuse together and have to be able to work together because there's a purpose. But that kind of brings me to my next question. I would love to hear from you, like your perspective of what really is the difference between, we keep saying like Western medicine, so Western or conventional medicine, and the functional medicine space.
Yeah, I would say in general, standard medicine is looking for a cluster of symptoms to identify as a disease. or lack of ease in the body dis-ease. And typically the treatment will be with a medication. That is standard and that is okay, right? Sometimes we need that. Functional medicine uses different testing and different ranges within the same testing to try to either prevent dis-ease or work our way backwards. And so the ranges, like let's say in blood work, are a little bit different in somebody in functional medicine versus standard medicine for what we're looking for. Then from there, I would say functional medicine incorporates a lot more holistic treatment. So we're looking at nutrition, food is medicine. We look at recovery, we look at exercise, we look at stress management. So it's a little more all encompassing versus standard medicine tends to be like treat X with Y.
Got it. Okay. I think my understanding has always been, so correct me if I'm wrong, like, well, as far as the testing side of things, and I even have in my notes here to talk about in the episode, like the optimal versus standard, right? Where it is like, okay, well, I know for the functional side of things, it's like what is optimal? Like, even if it fits in the standard Western range, it might not be what's optimal for you. Cause the Western range, correct, is it's like the average of the median of the population. Is that correct?
Yeah, so the normal ranges in standard medicine, at least in the Western world, are typically going to be based on the average population. And something I like to remind people of is like, think of the health of the average person now.
Right. And that's what I was going to take that too.
Isn't going to be what you and I want, your listeners want. And so for that, functional ranges are actually a little bit better because the standard ranges are 30 to 40 years outdated, right? People were a lot more optimally healthy about 30 to 40 years ago. And so functional ranges are looking for when an organ system is functioning at its best. That is optimization. It means we're healthy and it's not going to start to decrease. I think blood glucose is a really good example because we've seen blood sugar become a problem with insulin resistance and diabetes, especially in our country. And so that range is actually really wide. Some labs will have a range from anywhere from 65 to 110 in a blood glucose range. I know these numbers are irrelevant, but really a functional range, at least the one I use, is a lot tighter at 75 to 85 because if we're waking up with a fasting blood glucose of 65, you might be going hypoglycemic right away. Your brain's going to be starving for fuel. If you're waking up at 100, 110, like sweetheart, you're on your way to diabetes, right? And so like, let's tighten up that range so we can be healthy.
And I think too, a lot of times in the conventional sense, they'll look at it very acutely. Like, what are you showing up on this lab we ran right now? And like maybe somebody shows up as 85, 90 on that blood, like well, keeping with that example, right? And like theoretically in range, even maybe on the functional, not that bad. But if you were to do that test often, right, and look at it over time and see that's not their norm. I mean, I can even use myself as an example. And this is probably a better example. My TSH, so that is your thyroid stimulating hormone, which is what oftentimes they'll test as your main thyroid marker, which I'm sure we could go on a tangent of why that's probably not the most optimal marker to test, but it's a wide range. And my TSH always comes back in the normal. I think maybe you know better, but I believe the standard range is like 2 to 4. Does that sound right?
0.5 to 4.
0.5 to 4. That's what. Oh yeah, because I do want it to be a little bit lower, but because the higher your TSH is not as great. But so yeah, 0.5 to 4. But ideally, you want it. What's the functional just for reference? Is it like under 3, under 2.5?
Mine's really tight between 1 to 2.
1 to 2. Okay. So I was coming back in the 3s. And so I was normal on the conventional chart, right? But this was after my bodybuilding show and when I was in the slew of my hormone problems. So I was getting it tested pretty regularly. And I could see on every lab it was going up. So like I originally started at like 2, which was fine. And then it was like 2.5, and then it was 3, and then it was, but they kept only looking at that acute one test and being like, you're good. And I'm like, well, no, if I look back over it though, I'm trending in the wrong direction. So like obviously something's wrong. So kind of went off on a tangent there, but I think like being able those are kind of the things where I think it's important to understand how blood work's looked at. And the other big thing that you drew attention to as far as understanding that those ranges that they are looking at in conventional medicine are just an average of the population, which again, this day and age, we are like 70, 80% obesity rate, like crazy numbers. So I think we just need to understand that like, just because you're falling in that range doesn't mean it's your optimal range. And then what was the other thing I wanted to clarify? Oh yeah. So as far as the big difference between functional and conventional, would you say that conventional is very often just how do we fix the symptom, and functional is more what's the reason for the symptom and let's treat that reason?
I would say for the most part, that is correct. And also, it's more of like a one-stop shop sort of deal. Whereas if you, let's say you have bloating and you go to your PCP and you're like, I'm bloating, like run a couple of tests, blood work looks fine. I don't know what's wrong. Let me send you to the GI. GI does a bunch of tests with you. I don't know what's wrong. Let's send you to let's get to a colonoscopy.
Mhm.
Get a colonoscopy. I don't know what's wrong. Let's send you to endo. Like it is just this loop that people get stuck in. It takes forever. And at least in the way that I practice with functional medicine is we're taking more of a top-down view of like, okay, well, let's screen all those systems first and then kind of point our attention to what might be the thing and why that is occurring. And also, yes, it's let's say we go back to the bloating example. I've had so many people come to me and say, yeah, I was told I had bloating and I was just given Miralax forever. And are supposed to take Miralax, which is a laxative for the rest of your life. It's like, all right, well, that doesn't really fix why you have bloating. Whereas if you're
Right.
like coming into my container, it's like, all right, you have bloating, like, let's figure out why that is. Like maybe it's a bacterial imbalance or a parasite. You can eradicate those things or change them. And hopefully you don't have to take anything, eventually.
Yeah. I kind of went and I was gonna my next thing was gonna be like, can you give an example of how like a functional doctor you may treat something different than a conventional doctor? And would you say that I mean the answer to that is more of just having that one-stop shop top-down approach, or is there anything else you think differentiates that?
I think that's part of it. And also the recovery approach is a little bit more comprehensive. Now, don't get me wrong. I know some amazing docs out there that are trying to educate themselves, but the problem with standard medicine is that the actual education system for doctors, like medical school, hasn't really changed a lot. They
Mhm.
spend like 1 day on nutrition and it's incredibly basic, right? Like a regular doctor that has no concept of the health space or fitness, like doesn't know anything about nutrition. Like the amount of overweight doctors you go see,
Yeah.
it's kind of obvious. And so that's not really a part of most doctors' protocols, right? It's not like, oh, they'll just say change your diet. But I've had doctors tell me to put myself on 1,200 calories, and that makes zero sense. You would never put a woman on 1,200
Right.
calories. You can put a toddler on that, right?
But they
Um,
do.
yeah, they do, and they do, and it's really unfortunate because we have been programmed to trust this system blindly. And I'm grateful for the age of the internet because I think people can do their own research a little bit more so. I'm grateful for social media for that, where at least we can start to raise questions because a lot of the average person doesn't know how to access this
Mhm.
information, right? And at least now that they can, they see a viral video for whatever reason, can maybe go down the rabbit hole a bit. But the way that the system, like we like to say, the healthcare system works, it's to just trust it. You have insurance, you have to have it, and you have to go here. And if you don't go here, then we're going to send you somewhere else to go. And you just like follow this loop.
Mhm.
And I think the nice thing about the functional space is because it isn't regulated by the same umbrella as standard medicine, is that you have more options. You get to make that decision a little bit easier. And the treatment's a little bit more comprehensive with the right person. And so, yeah, like we find, something's going on with you. Yeah, let's try diet. Let's try supplementation. Let's try just getting basic sleep or water, right? Whatever it may be, to dig into what's going on.
I think that that's, yeah, big, really big distinctions. And I was going to ask from that, because what you were talking about, the internet, the day of the internet being, well, bringing a lot of attention, right? And again, I think it's made the functional, holistic, all these things buzzwords, which is good. I think it has its purpose, right? What would you, this is probably a loaded question, but if somebody's listening and they're like, maybe I need to like rethink if I'm like, if my doctors are telling me the right things, or how do I advocate for myself? Like what would be your recommendation for someone to advocate for themselves at the doctor? I know that's a very open-ended question, but
Yeah, I like that question because I think that that's a huge curiosity for a lot of people. If they hear what is functional medicine, what is holistic medicine, they don't know what that is. I tell people all the time, they ask me what I do, like, what is that, right? And I think the most important thing is to make sure that you have a provider, no matter where they're from, that is listening to you. Like if you can go into your doctor's office and ask a question without feeling like you were shut down or feeling like you didn't get the answer you were looking for, and then that's a quality provider. A lot of the times though, because they're on time commitments or they have quotas to meet, it's really stressful. Like I said, I worked in that system for a short amount of time, and in 4 days, Mallory, I saw 80 patients. It's
crazy.
not a normal amount to be working. You can't possibly give somebody the highest quality of care that you can. And so if you're lucky enough to find somebody that will, give you those answers because they exist, then That I think is step one. If you don't though, then you have to be able to ask questions and stay curious and like seek out second opinions. When I was given the multiple sclerosis diagnosis in 2021, I was like at peak health, and I did not believe I had a progressive brain disease. I had all the symptoms for it, but there was no way that I thought I was dying, right? It's essentially what they told me. And I kept asking. And when I didn't like the neurologist that I saw the first time, I got sent to another one. And when I didn't like that one, I sought out another one. And it was extremely time consuming and quite the investment. I flew across the country for it, but I finally found somebody who gave me a straight answer. And so I think just having the tenacity to like continue to seek out answers, because there always is one.
Yeah.
I talk about this a lot in my container. There's always an answer. You just got to keep digging for it. And I think that's the hardest part about advocating for yourself is we feel like, well, they said so. So it's everybody's like this, so I'm crazy. Or a really common one is like, well, you just turned 30 and you start gaining weight or feel like crap and feel tired because now you're 30. No,
No.
you're 30 and all these years of bad habits have crept up with you, or things that went unchecked because your labs were quote unquote normal. So now you're just feeling it because you don't have vital reserves to keep you feeling healthy anymore. It's not
Yeah.
because you're 30.
Yeah. And I will say, I feel like in the doctor's defense, because like one thing, at least is my perspective, like while sometimes it may seem like we're like, conventional, there's all these problems with conventional medicine, it's not necessarily the doctors themselves fault. It's the kind of the way it's set up, I think, in my opinion. But like I don't blame them for literally just quickly looking at these results and saying, oh, they're in the ranges. Like that's because when you are seeing 80 patients in 4 days, I mean, you just don't have the bandwidth. And I just even from being a patient myself, being like your client and seeing like what goes into looking at labs and looking at there is, I mean, especially hormone problems, which is a lot of what I think women are dealing with a lot of when ones listening to this episode that are interested in more of the functional space. If you understood how intricate hormones are and everything that goes on with the endocrine system, and then not only within just the endocrine system, but how the endocrine system affects every other system, like it is so much. And so to think that like a doctor with that much caseload on their plate is going to catch that one little thing on a lab that's not even showing on a lab, but it's like when you see this and how it's like they're not. And so, yeah, it's kind of when you think about it that way, it's like, oh, I see why, finding somebody who's going to really listen and take the time is so crucial. Now on that track, like if we are saying, the functional route is in a lot of ways, maybe not always, but in a lot of ways better. I don't know if you want to use the word better, if there's another word you would put in. Um, but well, I'll get into that. Like, how would you kind of compare the two? Is there like a bridge word you would use?
I think that each system has a time and a place. And so for the prevention of disease, functional medicine stands out through and through. For chronic disease, I also think functional medicine stands out. The kinds of things like hormone dysfunction or somebody's chronically bloating, chronic fatigue, like I really think functional medicine does a better job of that. Something where we may need pharmaceuticals, cancer a lot of the time can be where standard medicine is a great answer. Not always, but sometimes. But if like I also think acute injury, I
Yeah.
will never help somebody with a broken
You
leg.
can't fix the broken arm.
Can't do it, right?
That's
So
fair.
I think acute versus chronic is really
Okay.
important to
Well, it's
understand.
interesting
It's
that
hard, yeah.
yeah, and it's interesting you say that because yeah, I would typically, I kind of said it earlier, and you have a better point that I do think with chronic, even functional medicine can help. But I kind of said, conventional is oftentimes like, let's fix the problem after it's occurred. Functional, or did I say that right? Yeah, conventional is more, let's fix the problem after it occurred. Functional is more preventative. Well, ideally, right, we would never really get to the chronic because we did the preventative. But in that kind of frame, if even just the preventative, like come at it from like, hey, we should look at our health from a preventative measure. And I think we can all probably agree it would be better to do that than to ever like later get the disease in the first place. If that approach is like the ideal approach, why isn't conventional medicine up to date with that mindset?
It doesn't really make money, does it? That's a hot
Elaborate more on
topic.
that. Elaborate
That's
more on
a hot
that.
topic. Insurance doesn't cover preventative medicine. That's why. And until insurance does, some of them do. You'll find like in good corporate jobs where they want their people to be healthy, you'll find that it covers that. HSA plans might. For the most part, it doesn't cover it. And my opinion, this is an opinion, this is not a fact, is that there may be a small part of the system that is allowing disease to kind of run rampant because it's profitable.
Mm. I mean, yeah, it's hard to argue with that. Obviously, you hear a lot about like big pharma and everything that comes. I didn't necessarily expect that to be your answer. So I actually had another question, which now this leads perfectly into that. And now I'm like, maybe it doesn't make sense for this, but I was going to ask, do you ever see this space, the functional space, evolving to having insurance cover it? Do you think that'll ever happen? And maybe the better question is, do we want it to happen? Maybe we don't.
Hmm. That's a good two-part question. So do I ever foresee it happening? Potentially, there are functional medicine practitioners that are practicing like within standard medicine and bill insurance and can do that using certain codes, and that's not a big deal. They tend to treat very similarly to a standard conventional practice though. You come in maybe once every 3 months, but now it's I run a blood lab and you get a supplement. And I like to call it Western medicine in a mask. And it's very common and it's usually a lot of this in-person stuff.
I went to one of those
Now,
for you.
oh,
I went to one of those before you.
yeah. Me too. Um, and it's fascinating. It's fascinating because I think unfortunately, people lose trust in anybody, in medicine as a whole, like functional or not. Like I think there's a lot of trust that's been lost in our medical system. And that isn't how it's supposed to be. Like almost every practitioner, health medical professional went into the practice because they want to help people. Nobody went into, to med school saying that they wanted to hurt
Right,
anybody, as
of
far as
course.
I know. And so it's really a shame that this system has like been demonized and rightfully so in my opinion after having like been through it on both the patient and provider side. And it's a shame because like people just want to be healthy. And so do I ever think insurance is going to be a part of functional medicine? I think if the demand is there, like if really enough people were like, yeah, like we want to do things this way. Look at other countries in Northern Europe, and Canada is a little bit different. They actually don't believe in a lot of the functional stuff. It's actually blocked, which is like the opposite end of what we want. At least, in the United States, you have the decision. You can choose which route you want to take. In Canada, you have less of a choice. So it can be very, very difficult to know if that will occur. Do we want it to is more of a core belief of like centralization of any system or medicine. And for me, I always want to make sure people have a choice, no matter what that looks like.
Well, that was a question I just kind of added while we were talking because you mentioned something earlier when we were talking about the conventional medicine as far as like regulation, and I was like, maybe because in my head, of course, I'm after shoving out so much money when it comes to functional medicine, I'm like, it would be freaking great if this was covered by insurance. But then, of course, that brings a lot more like legislation into it and certain limitations and do you think it would end if that were the case, do you think it would end up looking a lot like the conventional medicine problems that we have today? Would it just turn into functional medicine in a mask?
Yeah, it's not a reality I even want to think about because I don't
Yeah.
think it looks good. Yeah. I'd be worried about access for people. I'd be worried about, I think it'd be helpful for credentialing. I think that there could be a little more regulation on credentials because pretty much
Yeah.
anybody could say, I'm a hormone coach. It's like,
Right.
what does that mean? You can take a weekend course and call yourself a hormone
Yep.
coach. So that, I think discernment's really good and just like remaining to be intelligent about any topic, right? Whether it's
Yeah.
medicine or, buying a house, right? Making sure that we're always educated. And as much as I'd love to see more education in the holistic space, like for practitioners, I do think that regulation would, maybe eliminate some testing or just make
Hmm.
it harder to be accessible. In some countries, they'll limit supplementation use in the same way that they would limit pharmacology. So
Do you see a world, maybe then a better thing is, okay, we want them to stay separate, but in terms of, you've got this that can cover like insurance, you've got this other, but do you see a world in where they can meld together and work well together? I mean, I feel like there's definitely times that happens now, but again, I feel like it's been very trendy and I'm guilty of this for sure, but I feel like it's been very trendy to pit the two against each other. But obviously we have talked about pros for both, even if we lean more heavily one way. Yeah, do you see like in the near future and in what timeline where you think that they could work a lot more harmoniously together?
I would love to see it happen in my lifetime. I think it could. I think with anything in life, any scenario, especially when legislation is involved, we see extremes. So we go so far to one side and then we go so far to another. before it can balance out in the middle. And I feel like we went, like antibiotics are a really good example. We went so heavy into antibiotics when you and I were kids.
Hmm.
Everybody had an antibiotic for everything. Well, then we saw
Hmm.
the detriment of antibiotics, actually antibiotic resistance in a lot of diseases. And these little, bacteria and viruses and things got stronger. And so we're like, okay, no antibiotics for anybody. And it's like, okay, well now we're kind of like, there's a time and a place for certain ones. Right. And so I think that can happen with the entire practice of like, okay, we're medicating everybody for all the things, everybody has 5 prescriptions. Maybe we'll start to see the detriments or like become more aware as a society, like that maybe isn't the best route. So like, let's use discernment as to how many we're using. And I think the pendulum has to swing, and I would love to see them come together. I mean, my like little tagline is like where woo-woo meets science, because I
Hmm.
really think that they can coexist. And I would love to see the standard of functional medicine like be upheld extremely high in the same way that somebody in a white coat in a quote unquote doctor's
Yeah.
office is held
Yeah.
high.
Absolutely. Okay. So we're hoping in the next few decades. Yeah, it sounds like we need to kind of, if we're on that trend, which would be great if we don't have to swing it either way, but like we first have to see it go almost all the way to like anti-medicine, like, and it's like, well, okay, we still have places where we could utilize, pharmacology and all those things and then find that middle ground.
Yeah. Yeah. It's a really good example of that. I just want to throw this in there for people that
Yeah.
may not be connecting the dots is like veganism. Like so far into like everybody needs to be a vegan, have an oat milk latte and like green juice to like carnivore.
Yeah.
And you can't have any vegetables. It's like you both are right. You should have
Yes.
both. You're like, and I
Yeah.
feel like that is where we see extremes in things.
Yes. I mean, if you think about it like that, I mean, we could sit here and probably pull out so many extreme examples of like whether it just be nutrition, fitness, the health and wellness space, or just anything. Like it is true. Like the human population just operates in extremes, and I could go on a whole rant. I'm just like thinking about it now. Like we are just such followers. Like everybody's a follower. So like when one thing becomes a popped up trend, like that is the trend, and then it's like it's one, the right person, whatever it gets out, swings the other way, and that's the trend, and it is kind of wild. Now, if somebody's listening to this episode and maybe they've heard about functional medicine, maybe this is the first time, maybe they're listening to this and realizing, wow, maybe like I am stuck in that loop, right? Like I am getting sent from PCP to whatever. How how would somebody know whether they should go seek out like the more functional route or the more conventional route?
Hmm. I would start with what you're currently doing and is it working? If you're, struggling with maybe anxiety and you're taking an anxiety medication, or you're always tired and you have a medication for that, or drinking coffee and it's like just not working anymore, and you've exhausted your options in Western medicine where they're like, oh, it's just normal to feel this way. Because I think that's the roadblock that is most often hit you. Check off the boxes. You don't have major disease. You try something, it works for a bit or it doesn't work at all. That would be the point where I think it'd be very safe to say that it would behoove you to seek something else out.
Okay, got it. I obviously the run-in for most people I think is the fact that it's not covered by insurance. So not that I'm saying, pitch, sell us on why, but like what is kind of how are you able to kind of show people this is worth investing in? And because obviously, yeah, I hear that all the time. Like, well, I'm gonna go work with the, mine's a little bit different. Because a lot of people coming to me are for more so, not all the time, but a lot of like more what's the word I'm looking for? Like, I mean, it's just aesthetic goals. It's not necessarily a life or death type thing, right? So I do understand why they're like, okay, well, I'm going to go to work with this dietitian because it's covered by insurance versus like this, more functional nutrition coach. But especially when it comes to like your true health, and like obviously clients working with me still, it still is, but I think it's easier to see when you're on the level of like disease, whatever. It's literally could be life and death. How are you telling them like it is worth spending the money on it versus just like doing the thing that's covered by insurance?
Hmm. Yeah, I think with anything, it's like, do you want to collapse time? Because typically, if somebody's even like aware of the functional space, they usually end up there anyways.
Yeah.
Or just seeking out a different path that hasn't been uncovered yet. I think what's cool about what I get to do is I have access to like lab testing that's outside of standard medicine. Like you can't get those at your PCP when we're running metabolite testing through hair or urine or saliva, stuff like that. And so having access to information that is different is really wonderful. And also there's a lot of awesome practitioners out there that are all encompassing. And that's something that people talk to me a lot about. It's like they want a relationship
Mm,
with their provider. And I think that's really important and really valued in the functional space for
yeah.
most practitioners is like, we know you.
Yeah.
We get to know what's going on. You have access to your practitioner. It's not like don't you get 15 minutes every 3 months. I think at the end of the day, I really see it as treating someone as a human and not as a number.
And that goes back to what you said earlier about like the volume that they're trying to do in more the conventional space and like how we were talking about it's not to their fault. They're just not going to have the time to catch the one tiny thing that it could be it's tiny air quotes, but like actually is the causation of everything. Right. And like sometimes those things don't show up on labs. Sometimes those things are, we've had this conversation a lot, are like the stress in your life, like the bad relationship you're in, the whatever, like something that you're not going to find from a lab, you're only going to find from talking to that person, knowing and understanding their day and their life. And if you miss that, you could be missing the treatment, right? So I think that's super, super important. Okay, my last question that I think, well, we'll wrap up with is now that somebody's maybe listened to this episode, they do want to seek this out. You said something earlier about that the space isn't super well regulated, and that's something we'd like to see change. Kind of anybody can call themselves this. What should I guess I'll make this a two-part question. How do you seek out finding a functional doctor? And then what should you be looking for the good one?
This is a tough question to answer. My standards are extremely high.
As I think they should
And
be. So I think share
yeah,
your standards.
yeah, I would say for me, credentials are great. And also I've met some people with credentials that aren't always going to fit the bill. So I think credentials are helpful. I think what's more important is somebody's experience in what you are struggling with. I think that that's incredibly helpful. If you're having a gut health issue to, ask that person, like, what's your experience here? Hormones, same thing. And it has to be outside of their own. I know a lot of these people are young, myself included, but I've handled hundreds of cases, right? And it's just like they've been a lot of the same. So it's like I have an area of specialty. A lot of people should have areas of specialty. I think that's super important. I also think then the kind of relationship that they're willing to have with you is also very important. If there's not a level of trust there, I find that we have this like white coat syndrome still where somebody's still like iffy about wanting to do the things or believing they'll work, and having a really good relationship with that person, no matter what title they have, is extremely important. And then honestly, like anybody else, if you're going to go to a coffee shop, you're going to look up the reviews before you head there. I think anybody can be that way. Like you want to start a program with somebody, like ask to talk to their previous, clients, ask to, or see what their reviews are like, right? I think it's important to really get, an answer that is authentic. Now it's hard sometimes in the social media space where even then it still isn't the best experience.
Definitely.
I've been caught in that multiple times where I thought it was going to be wonderful.
Yeah,
And it wasn't. So I think a lot of lessons are learned too.
definitely. What's like the literal how? I mean, would you say like social media is a great spot? People that, or would you say like Googling like function? And also too, I mean,
Yeah.
is there a difference between Googling it for ones in your area to go see in person versus virtually? I'd love your thoughts there.
Yeah. I think the biggest discernment I would use is like testing. For me personally, this is not what everybody practices, but for me personally, I have seen value in using testing that is outside of blood work. And most of the time, if you're seeing somebody like local to you, they're going to run a blood lab and then prescribe a supplement. And sometimes that works really, really, really well. And sometimes there's some things that are missing. And so if someone really wants to dive into like the why for hormone dysfunction or fatigue or gut stuff, like I truly believe that it can't just be right off a blood panel. And so that would be something I'd ask is like about testing. I find that some of the best practitioners are solely virtual.
Mhm.
And so I think social media is a really good place to start. As somebody could always, look up my page and see who I follow or, just start or who you follow, right? And kind of go from there, to just become educated in this space. I know even you asked me in the previous month, like, where do I start to get educated on this? And that was
Yeah.
a really hard question for me to answer because there's a lot of fluff.
Yeah.
And because I hold myself to this incredibly high standard, it's like, this space is only 20 years old. Like, there hasn't been a ton of experts. There are a few, and they're amazing. But I think we're still developing that.
Definitely, definitely.
Um,
And obviously, an obvious answer would be look up Sierra herself, and she's phenomenal and looking to, work with her. But obviously, everyone has like different needs and different specialties too. So being able to know kind of how to explore, I know it can be intimidating, it can be overwhelming. I mean, even just generally, like I'm like, because I still need to go to the conventional doctor sometime, right? Like my OB, I'm like, how do I find one when I moved here, right? Like even that normal. So this whole new space, it can be intimidating to try to explore and find the right fit for sure. But anyway, oh, go ahead if you want to.
I'm just reflecting on this because it's such a hard question to answer. And I think that like in our hearts, like we kind of have like a gut feeling, like if we know somebody's
Yeah.
intentions, and it can be really difficult, but really trying to discern like in that first conversation, whether it's in an office or on a call virtually, that somebody is paying attention to you in the way that you are seeking and is holding space for you. Even if they don't know the answer, they're like willing to
Yeah,
find it.
definitely.
And that I think discerns any provider from anybody else is like that they're open, they're
Yes.
willing to explore this with you, and they make you feel seen and heard. And at the end of the day, they can figure out the resources how to help you. I
Yeah.
think that would be my last piece of advice.
Absolutely, because something I have to even remind myself of is like doctors aren't God. Like I think it's easy for us to remember that or to forget that and think like because we obviously put so much hope in doctors, practitioners, any of you guys, right? Because it's like who else do we go to? You have to know the answers or who does. But they are just humans too. And like not every answer of every question that's possible has been discovered, or figured out yet. And so, but I think just having somebody who's willing to try to discover it is a big thing in and of itself. So I think that's a really good place to wrap up. This has been such a good conversation. If you are down to come back, I think doing an episode later on, more diving into like the testing itself, because that was kind of brought up there at the end, right? Like people might be like, well, what else is there besides blood testing? I'd love to do that and explore kind of what you can look for, find out all of that stuff. But thank you so much for coming on. I think people are really going to enjoy this episode. Anything you want to add that we didn't get to?
No, I appreciate you having me on. I've been grateful for your trust thus far, and I trust that everybody will end up like where they need to on their healing journeys. And I think the only thing is just like don't give up. Do not give up. There's always an answer.
Always an answer. Plug yourself. Where can people follow you?
So my Instagram handle is Dr. Dr. and then my first name, last name, Sierra, SieraBains. I've got, resources and links on there. You can also just Google my name to find my site, but Instagram would be probably the easiest way to find resources to learn.
Perfect. And I will put all of that info below in the show notes too. If you guys want to follow her, definitely do that. All right. Thanks again, Sierra. We'll see you guys next week. Bye.